What causes frozen shoulder, and what are the best ways to treat it? Hi, my name is Dr. Marc Gruner. I'm a board-certified sports medicine physician, and I see patients with frozen shoulder all the time in my practice. Today, we are going to get into everything you need to know about treating frozen shoulder and what to consider. First, let's talk about what is frozen shoulder. Frozen shoulder is not when your shoulder actually freezes. It's a condition that's called adhesive capsulitis. This is a condition, there's pain and stiffness in the shoulder, and it makes it hard to move. We nicknamed it frozen shoulder because you're unable to move your shoulder. It usually starts slowly with a dull, aching pain deep in the shoulder and the upper arm. Over time, pain can get worse and the shoulder becomes harder to move. People often notice that it's difficult to reach overhead, behind the back, or even perform simple daily activities. The pain often gets worse at night and can disturb sleep. Frozen shoulder happens most often in adults between 40 and 60 years old. It is more common in women than men, and it usually affects women that are either perimenopausal or postmenopausal. It is also common with patients with diabetes or thyroid disease, and it can develop after an injury or surgery if the shoulder is not used for a while. Sometimes there is no clear reason why frozen shoulder happens. The diagnosis of frozen shoulder is mainly clinical. This means the doctor will ask you about your symptoms, and they will also do an exam of your shoulder. The key signs are pain and loss of both active and passive range of motion. This means even when a doctor tries to move your arm, it is still difficult and you have a lack of passive range of motion. Frozen shoulder can especially make it hard to rotate the arm outward, and imaging tests like x-rays are not always necessary unless the doctor wants to rule out other conditions such as arthritis. So once the doctor has determined you have frozen shoulder, what can we do about it? Unfortunately, if you're waiting for frozen shoulder to get better on its own, it might take years. The recovery process is usually slow and may not be fully complete. In fact, studies show that up to 40% of people still have some pain, stiffness, or limited shoulder movement years after the condition begins. While the shoulder can gradually improve over time, many people continue to struggle with discomfort and difficulty using the arm if the condition is left untreated. Treating frozen shoulder starts with non-surgical options. Physical therapy is a critical and very important part of recovery. Stretching and strengthening exercises help reduce pain and improve motion in your joint. Working closely with a physical therapist and keeping up with home exercises are key to having a successful outcome. Medications like anti-inflammatory drugs or short courses of steroids can help reduce pain. Steroid injections into the shoulder can also ease pain and improve movement, especially early on in the freezing of frozen shoulder. For patients who do not improve with physical therapy or a steroid into the glenohumeral joint, which is the shoulder joint, sometimes we'll consider other options to treat the shoulder. Other options could include a capsular distension. A capsular distension is where we go in the front of your shoulder, and it's because there's studies showing that going in the front of the shoulder is more effective than going in the back. We do those under ultrasound, and we put steroid, lidocaine, and normal saline into the capsule and dilate the capsule. This is called a capsular distension. And then after distending the capsule, we'll do this in conjunction with physical therapy, which has dramatic success in treating frozen shoulder. There are other treatments of frozen shoulder if that doesn't improve, which includes surgery. Surgery is manipulation under anesthesia to actually break open the capsule to allow it to move more freely. Another treatment is arthroscopic debridement of the capsule, and both those treatments can be considered, but are rarely used with the new onset of capsular distension. Starting treatment early and staying consistent with exercises and getting a doctor involved can be your best chance to full recovery. What questions do you have about frozen shoulder? Leave them in the comments below, and I'll do my best to answer them. Hope you found this helpful. Remember to hit like and subscribe below, and I will see you in the next video.